Hello, everybody, and welcome to another show, Dr. Sheila Living Well. So, Living Well with Dr. Sheila. I am your host, Sheila Craig Whiteman, and I am fortunate to be able to have this show to do my passion, which is to educate the public on aspects of living your life better. So that's living your life better spiritually, mentally, physically. I cover all those different topics on the show. So my show, if you're looking at it live, you know I'm here every Thursday at noon Eastern Standard Time. But if you're not, I am actually on the network, KP Media TV, every Thursday at noon, and you can see me there. We stream on Roku, we stream on Google TV, Roku TV, Amazon Fire TV. And if you love listening, you can listen to the show on iTunes or Chromecast. So I have a guest today that I am so excited that she is here. She and I have worked together. She actually is a physical therapist also. So this is Dr. Tieya Qualls. She has a doctorate in physical therapy. She is the owner of, and I'm going to look down because I want to get this correctly because I am good at switching names. So she is the owner and founder of Quality Touch Physical Therapy and Wellness. And although we are global, she actually serves in clients in the DMV. And that's for you all who don't know, that's the District of Columbia, Washington, D.C., Maryland, and Virginia area. So she serves clients in all of those areas. She went to school. She got her BS at Hampton. She got her master's and her doctorate at, I'm going to tell you that in a minute, at Howard. And she has experience working in a variety of different clinical settings. And we'll get into that a little bit more because we're going to talk about both of our backgrounds, but we're also going to talk about pelvic health physical therapy because if you've been watching the show, you know that that is part of my background. It's not my only background. All of us are therapists. We do many things, but that is part of my background and then part of hers too. So we're just going to get together. We're going to talk a little bit. Hopefully you will learn a little bit more about what pelvic floor physical therapy is. And not only that, what is physical therapy? Because if you haven't gone, you might not know. I just recently had one of my colleagues, she said, I just went to physical therapy and I did not know that that's what you all did. Hers was ortho, but she's like, I had no idea that it was that you all had that much knowledge. It was a compliment. But anyway, so I'm going to bring Tieya or Dr. Qualls onto the show. I'm going to call her Tieya because I know her. I'm going to bring her onto the show and we can all say hello. So
Hi.
hello, how are you?
I'm doing well. Thank you for having me.
Oh, you are quite welcome. You are quite welcome. Now, let me know if I left anything out of your intro, because I kind of condensed it a little bit because some of the things that are in there we're going to actually cover and we're going to
Right.
talk about. So I didn't really want to say it twice.
Right.
So,
No,
yeah.
you did a great job. You did a great job.
Okay, great, great, great. So let's just start out. So we're going to talk first, we'll talk a little bit about us. How about we do that? And then we'll get into physical therapy and how what our journeys have been and what we currently do now. So how about you can start because you are the guest. So you can start out by telling the audience just how did you get into your journey of being a physical therapist actually, and then what you have done as a therapist.
Sure.
Briefly, because we've all done a lot.
hmm
So just kind of give us a synopsis on what you've done.
Sure. Thank you. So I would say when I was in probably ninth grade, I got introduced to the field of physical therapy through a classmate. We had to do some type of assignment about health careers. And so from that assignment, I did a little research at the time. Of course, we didn't have all the technology we have now. So I was probably at the library pulling out a book, an encyclopedia or something like that. And so I was really intrigued just from the research I did on the field because it was a helping field. And I always, like many of us, wanted to get into helping others. Then I ended up doing a little volunteer experience at one of the local hospitals in the rehab department. And I just thought, though, this was a really cool field. So that's where my journey started. Then from there, obviously, went through school, undergrad, grad school, and got into the actual meat and potatoes of the profession. And as far as the pelvic floor portion, I got interested in that as I got toward the end of my physical therapy schooling, just because we had a lecture from a couple of local women who had their own practice, and that practice focused on what they called at the time women's health. And so I was just like, oh, I can't believe there's some type of physical therapy that's geared toward helping women with wellness and rehabilitation for this area of the body that no one talks about. So I just got really intrigued by it and just kind of, you know, followed it from there. And once I got into my profession, that's when I really got excited about it. I started doing continuing education and different types of, researching on my own and got exposure to it. And I just fell in love with it.
Yeah, I can probably say my journey similar but not the same because and back in the day, so I am a little older. So when I also had an experience though volunteering at a hospital. I
Mhm.
volunteered at a pediatric facility,
Okay.
and I still fell in love with the profession,
Hmm.
and decided. And back, generation. If you go maybe up a generation, I think every 10 years or so, it's up a generation or something. So if you go up a generation, when you went to college, then you had to decide what you wanted to do. It wasn't any of that. You go to college and you can figure out what you want to do later. Nothing like that. It's like I know you pick a major and you go to school, and hello, that's what you're going to do.
Hmm.
So that's what my experience was. I've always loved being a therapist, so don't get me wrong. The funny thing about it is that when I finished and went out and got into the field and worked, I realized I did not want to do peds.
Hmm. Yeah.
After and that's what brought me to the profession. But
Hmm.
for all of us, or for many of us, actually, we have gone through a lot of levels and treated a lot of different
Hmm.
types of patients before we get to whatever that specialty that we really want to focus on is. And there weren't so many specialties actually when as
Right.
you start. It started being more specialized as time went on.
Yeah.
Yeah, because in the beginning, most of us, as a physical therapist, you did neuro, you did
Hmm.
ortho, you
Yeah.
did amputees, you did whatever came your way,
Hmm.
and you actually knew how to do it.
Right.
So it wasn't not quite as much of a specialty as it is now.
Right.
Now for us, and even for me, when I switched over to women's health, and I was actually doing oncology, lymphedema, then women's health because they're all kind of related with women.
Hmm.
Um, I didn't do everything else; kind of fell off. So I didn't do any neuro anymore.
Hmm.
I didn't do any amputees. You always do ortho,
Hmm.
because everything's kind of connected, but not so much anything else. So that is kind of, what my story is, similar to yours, but not quite. But
Hmm.
so tell me now, what do you love about the profession, or not love? We can even get
Yeah.
real down there. What do you love or not love about the profession?
Yeah, it's funny. The thing I love about it is when you get those clients that come back and tell you, "Oh, I'm so excited I can do, let's just say for pelvic floor, I can have sex without pain." Like most people who are having sex, they're not thinking about pain most of the time, but there are a large portion of people who do have pain with intercourse. And so that is a really debilitating thing. So when someone has told me that they couldn't have pain free sex for a number of years, and then I've worked with them and they said, "Oh my goodness, I've been able to enjoy this experience with my spouse," that is really a fulfilling experience because it lets me know I'm helping someone with their quality of life. So that's the best part, the outcomes. And I would say the not so great part would probably be, if I'm being honest, I would say when I was working in the in network part of PT instead of out of network, which has to do with insurance. It was a little tougher when you have to juggle too many people at once. I just didn't enjoy that. I like getting with that one-on-one experience. So when I worked in settings where we had to juggle 2 and 3 people at a time, that just was not my thing. I never liked that kind of experience for myself or for the client, quite honestly.
Hmm. Agreed. Yeah, yeah, I would have to actually second that. That's the
Mm-hmm.
one thing that I did not like. I think that's why a lot of even therapists come out of the
Mm-hmm.
um, that kind of a setting
Yeah.
because of that situation. I don't. Neither one of us are working in that kind of setting anymore
Mm-hmm.
um, because it's just very difficult to juggle a lot of patients, and you know that you really can't, give your all when
Yeah.
there's 3 people there
Mm-hmm.
for you to treat.
Yeah.
Um, yeah, and also the paperwork.
Right. Oh, 100%. The paperwork, I mean, that has evolved.
I mean, the paperwork is a job in
Yeah,
itself these
it's a
days.
whole other job. So yeah,
It
that
is.
paperwork is definitely a bear. And I think that that part, if we could do without it, if there was a way to get around that paperwork, I would
Oh
probably
my
love my job
God.
that much more.
I know. We would get so much more done too.
Yes,
It would be so much more efficient. But
exactly.
as they say, they tell us in therapy and school and everything else that if it's not documented, it doesn't
It didn't
exist.
happen. Yep. Yep.
So for that reason, you have to document, everything and cross those I's and T. No, dot the I's and cross the T's is the way it
Yep.
goes. Yeah. So tell me. So right now, are you doing? And I know, but I'm asking this really for the audience. So
Mhm.
are you doing just primarily pelvic health therapy, or are you doing other therapies as well?
So actually, my company, we are an physical therapy for any condition. Primarily, I like to focus on orthopedics and pelvic floor. So those are the specialty areas that I work with. But I'm open to any particular physical therapy appropriate condition. So we are mobile. So we, patient calls up, and we if they are interested in signing up with us, then we go ahead and give them the rehab that they need.
Hmm.
Hmm.
Yeah, which is a really good model, and it's a model that a lot of therapists, especially those that specialize, are moving over to.
Hmm. Hmm.
Because it's a lot easier and a lot less burnout, of course.
Oh
And I
yeah,
think the patient outcomes can be better. I don't want to be absolute, but
right.
they can be better. But
Yeah.
there's good therapists everywhere. Please don't
Oh
get me,
yeah.
because there are good therapists everywhere.
Oh yeah,
There
I agree
really are.
100%.
Yeah, yeah,
Definitely. And I would
yeah.
say also for the mobile model, for me, I like it because I get to see the people in their natural environment. When people come to the clinic, that's great. And that's one aspect of it, but you really get to see how people function in their space. And so
Hmm.
that can give you a little bit more of an opportunity to get creative with things, and help them to be very functional, like doing the things that work for their day-to-day everyday activities in their real live environment. So I like that part too.
Yeah, and actually, Taya and I both worked at the same facility.
Hmm.
That's how I met her,
Hmm.
actually. I was already there, and she came.
Hmm.
And she was there for, I don't even know how long you were actually. Um,
Probably about a year or so.
it was about a year. Yeah,
Hmm.
yeah, yeah,
Yep.
yeah. So
Yep.
that's where we met. And actually, I think that might have been along the time that you were starting to really get into your pelvic health.
Yep.
Well, it used to be women's health. And we'll interchange it. Probably both of us will,
Yes.
because it used to be called women's health physical therapy, and now it's pelvic health physical therapy because it
Yes.
encompasses men, women, children,
You know,
anybody actually.
yeah, that's funny you say that because that's something that a myth that I have to dispel quite often is that men, like you said, men and children have pelvic floor issues too. So it's not just a women's issue. It's an all gender issue, quite honestly. Everybody who walks around, even animals, they have pelvic floor. So, you know,
Hmm.
so anyone who's experiencing those bowel, bladder, and sexual issues, they can, get help from physical therapy. As long as there's no medical thing going on, obviously. But from a rehab standpoint, musculoskeletal standpoint, that's the thing I'm trying to get across to many people is that let people know, especially men, because they don't tend to check things out, that
Mhm.
you can get help for those things.
Right. And when we say those things, because that's the part that everybody says, well, what in the world are you talking about? And
Yeah.
you did allude to it a little bit because you said, bladder, urine, rectal, and I'm just adding in a little bit more,
Hmm. Hmm.
and just adding in a different layer. And of course, we can keep expounding on that so that people really know what it is. Because as much as you think people know about pelvic physical therapy,
Hmm.
they really don't.
Mm-mm. Nope.
So it's always a mystery, even something as, and I won't say as simple as, but as common as
Hmm.
incontinence. I do a lot of education
Hmm.
for women. I do a lot of talks for women's groups, and they're looking at me like I'm speaking something that they've never heard of in their lives.
Yeah.
Yeah, and you certainly do not have to, suffer.
Right.
We use that word, but with incontinence, there are things that can be done, as
Mhm.
well as things that can be done, as you alluded to, for pain with intercourse.
Yes.
Um, you know, uh, Abdominal issues, because I always throw that in there too,
Hmm.
because we
Yep.
always kind of put that pelvic floor, pee, poop, whatever.
Hmm.
But even abdominal issues.
Exactly. And
Hmm.
one of the things that I find when I talk to just a layperson, a person who's not in the field, their usually comment their usual comments may be things like, "Oh, I thought that was just normal. I thought that the leakage is just supposed to happen after I have had a baby," or, "Oh, I'm
Get
older.
older.
I'm older, and I thought that's just a part of getting older." And
Hmm.
while it can be common, that's the biggest thing we try to dispel is it doesn't have to be normalized, quite honestly. So yeah.
Yeah, that's a big, I don't want to say PR because, you don't want to put it like that, but that is a big educational barrier.
Mhm.
And I only focus right now, I used to do everything,
Mhm.
everything, but now I do primarily focus on incontinence.
Mhm.
Because I do mine just like you do yours mobile. Well, I do mine as an online program.
Mhm.
So it's online. So just think of the equivalent of telehealth, but in a
Mhm.
health coaching type environment instead of medical.
Right.
So yes, but I focus a lot on that, and I people have to realize too that bladder leaks, and this is for both of us. It's not just older people.
Right.
It's actually not just people who had children,
Right.
because there are even, I just had someone who had bladder leaks for most of her life,
Mhm.
um, and just decided, she's like, I just happen to find you. She's
Mhm.
not, because mine is online, so you can find me anywhere.
Right.
And yeah, so she's like, I just happen to find you, and oh my goodness. And yet she did well. So there is hope. There
Mhm.
really is hope. So how about let's talk about maybe what is your favorite success story?
I would say, ooh, this is a good one. Favorite? That's hard.
Yeah,
Yeah, because I so many times
there's a
where I
lot of
look back.
successes, right?
Yes, yes, yes.
Yeah, there's a lot of success.
Yes, I would say my favorite success story, and I'm gonna take it on back to sex because that was one of the ones that was really like it just was a near and dear to my heart. A person who had vaginismus, which is basically a condition where the person cannot tolerate any type of um, penetrative intercourse vaginally, and so this person wasn't able to even tolerate one part of the finger into the vaginal canal during the assessment. And by the time we were done, they were able to tolerate not only the physical therapy interventions and reassessment, but also being able to have successful intercourse with their spouse after not ever having, consummated their marriage. So this was a couple years in. That was probably one of my favorite success stories, just because I could imagine how that took a toll on the person's psyche as well as on the nature of their relationship. So once that goal was met, that just was like it was really special. I was glad to be a part of that journey for that individual.
Yeah. And yes, I've treated a couple of women, well, really more than one, which is really surprising.
Hmm.
Young women
Yeah.
who've
Yeah.
gotten married and have been married for, well, it all depended on, because I've, done a couple. So, it could be up for a couple months, and it could be like over a year,
Right.
and they haven't been able to have sex.
Right.
And yes, that is actually that is very rewarding.
Yeah.
And to piggyback on that, another rewarding scenario that I've had is women who are older, who are
Mm.
postmenopausal,
Yeah.
without husbands,
Hmm.
or boyfriends, who get back into the, I don't want to say the ring because it's not a fight, but get back into the program, and try to have sex, and they like, wait, what happened here? Like,
Hmm.
why can't I? I could have it before, but that was maybe 10 years ago.
Right.
And things do change, over time, and especially as you're going through that decreased estrogen,
Hmm.
perimenopausal, menopausal time period.
Hmm.
So those were actually kind of my favorites to
Hmm.
work with,
Hmm.
because they were really grateful too, and they gave them that second lease on
Yeah.
life, and just like, hey, I'm back.
Yes.
So
Yes.
yeah, so they were fun
Hmm.
towards the end, like once we got past that stress,
Yes. Yes.
of that going on. But yeah, those are fun, very similar situation. And what other types of, let's see, let's talk about other types, because I think if we give examples,
Hmm.
it will help people to understand a little bit more. Number one, what we do, and then
Hmm.
number two, what kind of conditions if this affects you,
Right.
that you can seek help.
Hmm.
Because a lot of us will say, okay, well, we help X, 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 and you
Hmm.
literally say, I don't know, incontinence, bladder leaks, and people still be like, that's not me.
Right. Right.
You
Right.
know,
That
something
is so true.
yeah,
That is so true.
it is. Now, something as straightforward as pain with sex, they'll be like, oh yeah, well,
Yeah.
yeah,
Yeah.
that's me. I can't even deny that. But
Right.
other things, they're like, no, no, yeah, I wear a pad, but
Right.
I don't really.
I'm laughing because that's how it is on my intake paperwork. My intake paperwork will say, do you leak? Or let's just say it says, do you leak? They'll say no. And then I have another question that may be similar. And I'm like, they say, I leak with sneezing, coughing, laughing. I'm like, I thought you said you didn't leak.
Yes, yes, yes.
So it's really funny because I think people being able to identify, or even, another good one is that people may say, oh, they didn't consider it because it's just a little bit. It's just a little bit. And I'm like, a little bit is important to note too, because we don't want it to become a lot, or we want to stop
Mhm,
that little bit. So that
mhm.
definitely, that's a good point that you made, just giving more examples. I would say other success stories have to do with, this one is a good one, with constipation. I
Yeah.
have that. People don't know that obviously, of course, we ruled out anything medical, but we've now narrowed it down to like the musculature. But people don't realize that chronic constipation can be worked on as long as we ruled out anything medical going on. So people that I get for that particular diagnosis, they are so like excited that they can have a full evacuation, for instance, or they can actually go a little more frequently. And that to me is so like important because I could imagine, just the discomfort that someone's feeling when they're getting bloated a lot, pain, at that opening and everything. So I would say those particular patients are also have been really good success stories where once we teach them some of the things that are contributing to constipation from a diet lifestyle standpoint or from even like exercises that they can do to relax those muscles
Mhm.
of the pelvic floor, it's like once they get it, you can't tell them anything at that point, and they're just so grateful. So
Yeah, and they're very motivated.
Yes, 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 yes.
So yeah, because it's actually nice too to have the clients that are more motivated are the clients that either have pain or it really affects some aspect of their
Hmm.
life.
Exactly.
Because the more motivated and the more adherent they are to the program, uh, number one, the faster they'll even see results. But
Mm-hmm.
even to see results and
Yes.
not relapse,
Yeah.
relapse.
And you just made me think about something too. Another great thing I like to, I guess, see or discover is people who have had leakage. For instance, let's just say it's a postpartum individual. They come in, or I come see them, and they're like, "Well, I've been doing my Kegels. I've been doing my Kegels, but I'm still leaking."
Oh my gosh! Oh my gosh!
Yeah, they'll say that they're doing their Kegels and they're still leaking. And of course, that's very, very debilitating, especially for those more active people who want to do
Yeah.
more heavier and high impact things. So I do the assessment and I find, well, while there may be some weakness aspect, there also is a tightness aspect to the pelvic floor
Hmm.
muscles, as well as the way they activate their muscles when they are cued to do so during the assessment, and how that translates over into running, jumping, pushing, pulling, things like that. So
Hmm.
when they find that, oh, we have to work on more than just Kegels, they're they're just so excited to find something that actually can help improve the leakage.
Right.
Um, one of those big things is just reminding them, this is a system. Our body works as a well-oiled machine. So if we have weak muscles of our core and weak muscles of our hips, then guess what? It don't matter how many Kegels you do. You still probably
Hmm.
have some level of dysfunction, in this case, some level of leakage or whatever the ailment is, because we haven't addressed those, surrounding areas. So that's something that I really have found has been a great eye opener for a lot of people when I educate them on that.
Yeah. Actually, educating clients slash patients to do the Kegel correctly
Yes, yeah.
is really the one of the big milestones and big hurdles
Hmm.
um, for a lot of women, not all, but a lot of women with incontinence. Because even and I'll go back to when I was in the clinic because I did pelvic health for probably about 10 years. So I did it a long time.
Hmm. Hmm. Hmm.
So I saw hundreds of women, and you kind of alluded a little bit to some of the things that we do when you were talking about um, when you assess the person with sexual dysfunction. But we do manual techniques, meaning we do use our hands, gloved, of course, glove
Yes,
clean. So we
yes.
do use our hands on into the pelvic floor and into the vaginal region, sometimes even the rectal region, actually.
Hmm.
But that's one of the ways that you can assess strength. And you're not just assessing strength, but you're assessing strength and function.
Yeah.
And I used to, and I tell this story all the time, even when I'm doing talks, is I would assess in my finger, or use my finger, and try to assess the strength of the
Hmm.
person doing the Kegel. I say, okay, well, give them the cue, go ahead. Do you feel my finger? You can squeeze, lift, or do a Kegel for what you think a Kegel is.
Hmm.
And literally, you can see their whole body tighten up. No
Hmm.
Kegel, but
Yeah.
the
Hmm.
glute contraction is about to squeeze whatever. So the glute contraction, the face is holding the breath, just all kinds of different things that they do to
Hmm.
simulate to their mind and
Hmm.
body that it's a Kegel, and it's not.
Yep.
So getting past that hurdle actually is a big one. It,
Agreed.
yeah,
Agreed.
it's a big one, and it's once they can get that, you're halfway there. Actually,
No, I
you're
agree.
halfway there. Hmm. So we do work on it. So let's talk about, and we'll go back to some of the success stories that we've had. But let's talk about men.
Hmm.
So because some people we've talked about male pelvic health,
Hmm.
and I know for some men listening, their ears are perking up because they're like, "What? What do you mean?" Especially since I just had that last explanation.
Mm-hmm.
about the glove finger.
Yeah. Yeah.
Yeah, so let's talk about men, and just briefly. We're not going to go do a whole treatment protocol, but
Right.
what can we can do for men, and what can they see us for?
Right. I'm glad you asked that question. So one of the biggest things that I'll educate on, and the people, even when I worked in the clinic, for instance, they would come in, or even if I see them in their home, they're like, oh, I didn't know that the pelvic floor therapist could do anything for this. One of the things is erectile dysfunction. Now, with erectile dysfunction, they have already seen the urologist. We would have needed to have them see the urologist to rule out anything with regards to blood flow or any underlying pathology, medical pathology. But once that's ruled out and the urologist and has been able to say it's more musculoskeletal, meaning muscles, joints, tendons, things of that nature, um, then they would see a pelvic floor physical therapist. And so when I'm working with a client who has ED and they've told me like they have a hard time either achieving or maintaining an erection, and then they find that, oh, with this release of these tight muscles, now I'm able to experience this even better, or it's more enjoyable for myself and my partner, or whatever the case may be. That is like a huge, they feel very, very grateful, obviously. And as a therapist, I'm glad I could have helped along that process. But typically, what I find in these patients is a lot of times there's a lot of muscle tightness of the pelvic floor region and of the abdominal region too, even the back region sometimes. And it's not that those things are going to be, the back is going to be like the catalyst, but that could be a part of the whole sequence. And so I find that doing some release work, or stretching for layperson's terms, of these tight muscles and fascia around the tummy area, the back, the abdomen, and the pelvic floor, it really can help with that particular condition. And in addition to that, it may be other things too that we would have had them seeing their primary care or their urologist for, from a medical standpoint, because they may need medication management as well. But from the physical therapy standpoint, I find that muscle tension is a huge component of that.
Hmm.
Oh, and I
Yeah.
was going to
Oh,
mention
go ahead.
too. Yeah,
Hmm.
I wanted to jump in there one more time and say all, and a lot of it has to do with that compression of those nerves and blood vessels to the area from the tightness of the muscles and fascia around that region. And so, one population I find that in is bike ride, people who ride bikes, males who do bike riding or spinning a lot, I guess from the seat, from the time spent on the bike in the saddle. That's one of the biggest populations that I find they may experience that, not only the ED, but also pelvic pain that they've been kind of ignoring for a little bit. And even some
Hmm.
urinary symptoms like urinary retention, like not being able to get all of their urine out. And it's been ruled out that they don't have a prostate issue. So yeah.
Hmm. Yeah, that's actually the spinning, because as you know, I taught spinning
I
probably for
know.
about 15 years. That was
Yeah.
my thing. Love spinning, and I still do. I'm gonna get back to it. With the pandemic, I kind of took
Mm-hmm.
time off and went to more yoga, Pilates,
Mm-hmm.
the more not so much the hit or the hard cardio. But you find that in women too, and that the saddle, they have special saddles sometimes for. I mean, they do have special saddles for these people, but the saddle and then leaning forward, you
Yeah.
are putting a lot of pressure on that area. So it's more common in men only because of an anatomy standpoint. Their anatomy is outside, ours is
Mm-hmm.
in.
Mm-hmm.
But yeah, it can cause issues like that. But if you love spinning now, just take the precautions and just keep going. It's a wonderful exercise.
Yeah.
But of course, if you're having trouble, make
Yeah.
sure that you do whatever you have to do so that does not occur.
Yeah. You,
Yeah.
you just made me think about something too, from an activity standpoint. I remember having a male patient that this particular patient was having pelvic pain. They didn't know what was going on. They thought it was something like a STI, for instance, because they were having like this burning sensation, which muscle tension, compressing nerves and blood vessels can present like burning sometimes. And so they had that ruled out. and we were working together, and I asked a thorough history, and they were like, I don't know what could have caused it. I don't know what could have caused this tightness. Come to find out, this person was a sailor. They did sailing as a sport,
Hmm.
and at that time, I wasn't as familiar with the mechanics of sailing, and I had to ask the patient to break it down for me and tell me what exactly did that involve, because they said they did this often. And what I found out is apparently with the sailing team, there some members would maybe kind of hunched over, or I want to say a railing or a cord or some kind of object that is on their abdominal region, compressing that area, but they're
Hmm.
not thinking about that because they're trying to win the race or whatever the competition is. And that particular member is kind of crouched over this object for lengths of time. And so, come to find out, that was a huge part of why that area had that dysfunction with regard to the muscle tightness and the pain. Even though they hadn't done that in quite a while, just the chronic nature of what they were doing before, it just played into their current symptoms because the musculature of the abdominal wall had just gotten used to being engaged and then compressed for quite a while, and unfortunately led to some level of pelvic floor dysfunction for this male patient of mine. So I thought that was really interesting. And again, once we found it out, we were like, I was able to educate more on, just some things that this person could do. I never like to tell people to stop doing something that they love doing, but we do have to work around some of these things, like maybe cutting back for a brief period, hopefully some people
Hmm.
longer, just to give the body a chance to recover. Because even for general exercise, like fitness things we do, we don't give our bodies a recovery period, then we may feel extremely sore, we may feel extremely tight, we may get injuries. So that's why we had to talk about giving the body a little recovery from a lot of high impact, or not even impact, but high repetition abdominal exercises, things like that, because the
Hmm.
abdominal wall, I find that could be so key in a lot of those male conditions.
I like that you brought that up about sailing because
Mhm.
I really don't know anything about the sport.
Right.
So yeah, so even as and if any therapists, health providers, or whatever are looking at this show, that's an excellent point to bring up. Is that you have to look at their well, in school it will be extracurricular,
Yeah.
but their leisure uh,
Mhm.
activities as adults,
Mhm.
just to see what the mechanics of that is. Because usually, if people have a problem, you can not always, because it's not always, the human body is very fascinating, but
Yes.
there are a lot of times you can trace it back to something,
Yes. Yes.
or even something to investigate as a
Yeah.
possible cause.
Mhm.
Not necessarily that that is it, but there are always several different avenues that you can maybe pick and choose
Yeah.
to try to figure out what you can do to help the person to feel better.
Mhm. Agreed.
So yeah. So yeah. Oh, so I love this conversation because I think what we are doing is giving people a better idea and perspective on what we actually do.
Mhm.
Because
Exactly.
I'm thinking, both of us do talks. So
Mhm.
because I've seen you, I don't know if you've seen me, but I do a lot of talks. So, and the talks though are always on a specific subject
Mhm.
usually. So people will say, come to me and say, can you talk about, menopause and pelvic
Right.
health, or
Right.
menopause and bladder leaks, or whatever. But it's not always, oh, let's talk about this, and then we're gonna go talk about that, and then we're gonna talk about this,
Mhm.
because then you're gonna seem like you're a crazy presenter.
Right.
You don't even know what you're talking about. You're just going from one thing to another.
Right.
But this is good because it gives, we've given a lot of examples
Mhm.
actually,
Mhm.
and probably can still, we do have time to even give more,
Yeah.
because there are still other conditions that we treat.
Yeah. Yeah.
You
Absolutely.
know, yeah, there are.
Absolutely.
And for men, we also treat men's incontinence.
Yes. Yes. Yes.
So I think that's a big thing that they may or may not be aware of. A lot of neurologists, or some neurologists, will refer,
Yeah. Yeah.
because they will refer because they know. And as a matter of fact, physical therapy, we get referrals anyway from all kind of physicians who are like, I don't know,
Yeah.
kind of go to physical therapy because
Mhm.
we have the time,
Mhm. Mhm.
to kind of get an overall view and figure out what's
Mhm.
going on. But yeah, I don't want men to forget that incontinence is on the table too.
Yeah, especially after having any kind of prostate surgery,
That's great.
I find that
Hmm.
that's one of the best times to get in with your pelvic floor therapist. Usually, the urologist would have referred the
Right.
patient to see a
Hmm.
pelvic therapist, but there's been some patients that reached out months later and they hadn't been instructed to see a pelvic therapist. They were instructed, however, by their urologist, oh, do these Kegels. And I want to get away from the term Kegels because that's just the last name of the male
Person. Hmm.
that I
Yeah.
provided, but it's a pelvic floor muscle contraction. So,
Hmm.
but yeah, they'll just tell the patient to do these contractions, but not really realizing the patient may not even know what you're talking about. One, and then two, if you're not assessing how they do it or telling them instructions on how to do it, you've sent them home without any real understanding of how this is going to work or if it's helping or hurting them. So that's something I found that when they start early after surgery, that's the best. And of course, we can still get things done even if it's not early. But post
Right.
prostatectomy, that's a really important time to get that pelvic floor physical therapy in, so that we can give you the best opportunity to hopefully have little to no leakage as possible.
Right. And just so you saying that, just know that leakage is not a definite consequence of having the surgery.
Yes, exactly,
Right.
exactly.
Yeah, because I think people need to realize that also.
Hmm.
Men need to realize that also.
Yeah.
And yes, a distinction because I always usually do use pelvic floor muscle contraction when I'm speaking,
Hmm.
but everybody knows the word
Kegel,
Kegel.
yes, yes, they sure do.
And yeah, so if you're talking to non-medical professionals,
Hmm.
it's an easier,
Turn.
as they say when you're doing speaking about medical things that you're supposed to speak in the language people understand.
Exactly.
Yeah, so so you're right, but we need to start interchanging the words so
Yes.
that you can hear it a little bit more frequently
Hmm.
and begin to associate the two of them together.
Exactly.
Yeah, but we would have to get the physicians to stop saying it too, and I don't know
Yeah.
about that.
Yeah.
That's gonna take even longer because they sure will tell you to go do a Kegel.
Right.
They sure will say go do a Kegel.
Yep.
So
Exactly.
yeah, and I'm trying to think of any other different conditions that I mean we all get odd conditions.
Hmm. Hmm.
And I won't say odd, but things that you don't see every day. So
Right.
the people with coccyx issues or
Hmm.
that kind of thing.
Hmm.
But you don't see those every day,
Right.
and but they're very painful.
Yeah. Yeah.
Yeah,
Absolutely.
and you can get relief. So if you are one of those unfortunate people who, and usually it's from a fall,
Yeah.
yeah, or just some high impact
Yeah.
to that area that you've either dislodged, moved,
Hmm.
fractured your tailbone,
Hmm.
as it's most commonly called. But
Hmm.
um, there is success with that too. It takes a while. At least the ones that I had, it took a little bit of time though,
Right. Kind
because that's a very sensitive area, and
absolutely.
it's yeah, yeah. But you can get relief,
Yeah.
and people will find us after they've exhausted everything else.
Exactly.
So they're anxious. Because that has a lot to do with it too. It's a
Oh
lot of
yeah.
anxiety, depression, and just it's just my life,
Mhm. Mhm. Yeah.
you know.
You know,
So
you just hit on something too. That's a large part of what we do is making sure we address from a like at least identifying if the person's anxieties or any kind of mental health component is playing into the symptoms as well. Not that we are mental health professionals, but if we identify something that could be playing into that, we, should be talking to the patient about seeing someone who can address that area as well. I found that that can be a huge part of recovery
hmm
physical ailment, addressing some of the the mental health parts, especially because with anxiety, for instance, we know that our autonomic nervous system, which is our fight or flight system, plays a large role in um, it has a lot of physical response. So muscle tension,
Mm-hmm.
generalized muscle tension. If I'm riled up, and it doesn't always have to look like riled up. I have people who look very calm on the outside, but on
Yes.
the inside they're really anxious because of whatever their lifestyle is or whatever they've experienced in life, and their muscles are going to follow suit. They're going to tighten right on up. And so that includes
Mm-hmm.
your pelvic floor muscles. So that's something that I try to really, just gently, obviously, I don't want to have someone feel shame or embarrassment or anything because, that's not a topic that is easily discussed. But I try to let them know if that is something that they're experiencing, that might be something to address with the proper professional, mental health professional, to be able to just be a good adjunct to what we're doing for the physical, because sometimes we can do all the things. We can do all the things as physical therapists, and if other components are playing in to it, then that just kind of will, contribute to some level of plateau. And we don't want that, obviously, and the patient obviously doesn't want that either.
Mm-hmm.
Mhm.
Absolutely. Yeah. Very good point. Anxiety and stress.
Stress, yeah,
Chronic stress will almost kill you.
yeah, yeah, absolutely,
It's very debilitating and actually, put your body in that high state of inflammation, and it's
yeah,
just it's not good.
no,
But so that even gives you another layer of
hmm,
what we as physical therapists do. So when you come to us, it's not really that we treat whatever it is in isolation,
right,
because
exactly,
we almost can't.
no,
you
mm-mm.
know and I'll take that back. So if you come and you have a broken finger, okay.
Right, 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 right,
Yeah,
exactly,
because I don't want you to think that because we do, as we talked in the beginning, we do ortho we just have public health for the majority,
mm-hmm,
but that doesn't mean that that's everything that we do.
mm-hmm,
So yeah, I'll take it back. If it's something really simple, a simple broken bone, you broke your ankle, and you needed rehab so that you can walk properly and go up and down the stairs. Fine. Now, of course, I'll just say we're still going to see if you're stressed out,
right, exactly.
because that's still because you won't even really be able to finish your program, do your program, um,
You
if
just
you're
said it.
overwhelmed.
Yes, you just said it. I was going to say the same thing. If you're having a high level of stress and you are now asked to perform a new home exercise regimen, for instance, we could be giving you all the greatest information in the world, but
Hmm.
if you have other barriers outside of that, that just may not serve you well at that point in time, quite honestly. So that's why we have to. That's why I love that our profession has grown so much, and we have to look deeper, because
Hmm.
otherwise we could be missing something that's really key in getting people better.
Right, and actually, and being able to refer them to the
Yeah,
appropriate
appropriate
professional,
professional.
because we're
Exactly.
not saying that we are the be all do
No,
all, but we're
not at
saying
all.
what we can see. You might need someone mental health. You might have to be referred back to orthopedic. You might have to be referred back to your gynecologist or
Right,
your pelvic specialist.
right.
So yeah, but we would be especially if we see you on a regular basis,
Mm-hmm.
one of the people that could really tie that together and kind of connect the dots.
Mm-hmm.
Because as you see different health professionals for symptoms, it doesn't mean that the dots are connected.
Absolutely. Absolutely.
Yeah, so sometimes it's good that you have this one person who's like, wait a minute, you saw Dr. So and so, and what happened? And you saw Dr. So and so, can you just give me a little update? And, so that everything can kind of fall together.
Exactly. Exactly.
Mhm. Yeah, yeah, yeah. So in our see, time just really flew
I
by,
know it's
really
going
flew
too
by.
fast.
But so tell us a little bit about, and I'm going to put you on solo view, because we're going to put your information for how they can contact you on the bottom of the screen.
Okay.
So while you're talking, I'm going to be in the background just typing away.
Sure.
So
So
tell us how you can, tell everybody how they can contact you.
Sure. So again, I'm the owner of a mobile physical therapy practice in the DC, Maryland, and Virginia region called Quality Touch Physical Therapy and Wellness. And you can reach us by phone at 301 246 2353. You can also check out our website at www.qualitytouchpt.com. And we are on all social media platforms at Quality Touch PT. And so you can kind of reach out any of those platforms. You can send us an email or message us, and we're more than happy to reach out to you and try to get you scheduled if need be, or get you to the right professional if we're not the right fit. But all in all, we're available for any of the customers in that DC, Maryland, and Virginia region.
And how about you repeat that again?
Sure. Again, you can reach us at 301 246 2353. And you can find us on our website, www.qualitytouchpt.com, and on all social media platforms at Quality Touch PT.
Got it. All right, so we have the information. Taya talked a little fast there,
Oh,
but I
sorry.
did. I was able to get the website up. Is that correct?
Yep, that's absolutely correct.
Okay, all right. So, and tell us a little bit about who can, what type of
Sure.
patients. Yeah.
Yes, we treat, first of all, orthopedic and pelvic floor conditions, and we treat all genders. So, whatever you identify as male, female, non binary, transgender, we treat all conditions for all genders, for orthopedic and pelvic floor. And we provide mobile services in your home, or if you have a private office or private space. And we also offer virtual services, basically telehealth visits as well.
Wonderful, wonderful. Okay, so we got that information. So we're going to take just a quick break and then we'll come back. We'll close out because we just had so much fun. Time flew by. But let's take this quick break and we will be back in just a second.
Do you suffer from bladder leaks? If you have ever leaked a little when you call for exercise, help is available. 1 in 3 women experience bladder leaks in her lifetime. For a free consultation, visit our website, thepelviccoach.com.
So I'm back. So that was just a brief commercial on my business. So if you do have bladder leaks and you just have questions, you can go to my website. It is thepelviccoach.com. Very easy to remember. And go ahead and put in for questions, put in for a consult. It's totally complimentary, so you don't have to pay for anything. You can answer whatever questions that you have. Also, if you're interested in getting a copy of my book, now I could not have set that up any better. I have a book on bladder leaks, to pee or not to pee. That's book number 1. If you want a free copy digital of the book, you can go to pee or not to.com and get your free copy of the book. So I'm going to bring Taya back on. We're going to go ahead and say our goodbyes. And there you go. There you go. So thank you so much, Taya, for being on the show. It was really, really a pleasure. Maybe one day we'll come back on and we'll delve in a little bit more specifically
Yeah.
on what different conditions, what you can actually do for them.
Yeah.
But I think this was just a really good idea, just to have people know really what we do, because you just people don't know.
Right.
And I find that every time I go out, I'm like, why don't you know what we do?
Right.
It seems like so many of us talk about it, but apparently, and one person told me this. They said, you think you're talking to people in the public, but really you're talking amongst yourselves.
Yeah. And that's
So
true.
that's really who the audience is. People who have searched or who follow you or whatever. It's people that are people in the field.
Mm-hmm.
So I thought that was really, really interesting. But
Yeah.
that being said, do you have any last words or anything you want to say, or just
Yeah.
repeat your website or whatever?
Yes. Well, first of all, just thank you for having me. I'm glad that I can come and have this chat with you. It was very fun. I love chatting with you about these kinds of things, even off screen. So this was great. And, again, if you want to reach out or if you want to get services in your home, if you're in the DC, Maryland, Virginia region, you can find us on all social media platforms at Quality Touch PT, or you can reach us by phone 301-246-2353.
Thank you so much. And again, I am Dr. Sheila Craig Whiteman, and you are watching Living Well with Dr. Sheila. Thank you so much for joining us. And every Thursday, Eastern Standard Time, I have a lot of Pacific Standard Time people. So those of you who are up and looking at 9 a.m. Pacific Time, 12 noon my time here. I look forward to being with you every Thursday at noon. You all take care. And thank you so much, Tieya, for joining me.